My name is Joel Chacha and our sign language interpreter is Walter Asel. Moving on, St. Irene Girls School students narrowly escaped death after one of the school dormitory caught fire some few minutes after the students left the dormitory for morning class preps. According to the residents residing next to the school, they said the fire broke up some few minutes to 7 a.m. Confirming the fire incident, the school management said the students and the school staff are all safe, though the students' belongings in the dormitory were burnt down to ashes. The school's management is appealing to the well-wishers to intervene in aiding resettle the students.
Wetu kama kaunti ya Samburu, kuna namba ambayo imeandikwa pale kwa hili gari. Pia tunahimiza kuwa namba hiyo kila shule iweze kuichukua. Kila mkaji wa Samburu aweze kuwa na hiyo namba, ili mkasa kama huu wa moto unapotokea wanapiga ile namba kwa haraka. But ninashukuru kuwa wenye walikuwa na namba yangu walinipigia na nikaweza kumpigia fireman na tukaweza kukimbia kwa haraka kukabiliana na moto huo.
Watoto wetu hawajapata ajali yoyote, na hiyo ni jambo la kumshukuru Mungu. Dormitory moja imeshomeka na vitu ambazo siko ndani zote silisha.
Na tuliokoa mahali tulifika. The problem ni kupika simu late, kwa sababu hawa wakati sasa walikuwa wameanza sasa, hiyo moto ilianza, hawa walianza kusimisima na maji, badala wapige simu immediately.
We shift our focus now to matters health. Corporates have been urged to support the fight against children cancer by supporting fundraising efforts for early identification and treatment. Speaking at a charity bowling tournament held at the Gertrude's Children's Hospital and Gertrude's Hospital Foundation, Dr. Robert Nyarango, the Gertrude's Hospital CEO, said that early diagnosis is key to helping reduce cancer-related deaths among children.
One of the events or the activities that we do under the fundraising activities is the annual charity bowling tournament, where we are able to raise funds to assist the poor and the needy children to take care of their cancer needs. We have a lot of children who have cancer and need to do tests and diagnostics and even treatment, and they cannot afford to do that. But what we know is that everybody is supposed to be entitled to the same quality care, timely care, and care that can help them fight cancer.
We always have CSR projects every year, so this was one of them. So looking forward to many more of this. I would advise more organizations to plug in to get that opportunity to also give back to the community.
The initiative is a good CSR initiative for us, because one of the core mantras that we have is to provide quality nutrition, yeah? And quality nutrition means that we're actually touching and impacting our community.
Curtains fell on the second annual Transforming African MedTech Conference led by Vilgo Africa. The three-day event, which successfully launched in 2023, brought together 120 MedTech delegates from 14 countries, all driven by a common goal to shape the future of healthcare in Africa. The conference underscored the significant demand for collaboration and networking among African professionals in the medical technology sector, aiming to accelerate the growth of medical technology development and commercialization across Africa.
Actually endorses the idea of innovation and transformation, looking at issues of digitalization, looking at issues of, innovative medical technologies to support routine clinical care or management, but also most importantly to safeguard public health on the continent.
We believe that Africa needs to start owning our own healthcare. We need to stop sending patients to India and other places. And that's only possible if we start innovating solutions locally.
By designing specifically within 4 low-resource settings, affordability and accessibility are key constraints that we have addressed. We work directly with our hospitals, both public and private sector. We engage governments, we engage NGO and multilateral agencies, and we engage the private sector. Anybody who is addressing the critical need of improving newborn mortality is who we are working with.
It is an economic driver because the people, young or otherwise, who are innovating and manufacturing are going to be developing jobs. So it is going to be a big job booster. Very, very excited to see what happens in the next 2, 5, and even 10 years to make this vision come true.
Away from that, Kenya Tea Development Agency KTDA National Chairperson Enos Njeru has revealed that the unsold tea in Mombasa tea auction will not affect bonus payout to 600,000 small-scale tea farmers in the country. Addressing a press conference in Runyenje's constituency, Njeru noted that tea sales in Mombasa have increased, and by the start of October, the agency is estimating that all the bulk tea will have been sold. Njeru attributed the delay of the unsold tea to the ban of the direct sales of tea.
Ambayo imefanya kuwe na stock kiasi ya juu Mombasa mwaka huu ni sababu ya kufungwa kwa direct sales, ile ambayo buyers wetu walikuwa na identify factory fulani na quality fulani ambayo wangependa kununua. So walikuwa wanaenda kwa factory, wana negotiate, wana agree, and then they sign a contract ya kununua majani kutoka kwa that specific factory. Soko inaendelea kupanuka, na saa hii tutakuwa tunauza majani mingi, na niseme hata saa hii hatuna volume nyingi za kuuza mwaka huu vile tumefungua, sababu majani imekuwa chini kidogo. So tumeonelea vile inaenda kwa wingi na price mzuri, kwa sababu ni kidogo bado tukiweza kumove zile volume zingine. Tunatarajia kwamba hiyo balance ingine ya over 60 million, about 60 million ambayo ya majani chai ambayo haikuwa imeuzwa, we expect to have been sold by end of September. By October tukilipa bonus, wakulima wote watakuwa na pesa ndio wakaweze kulipwa bonus vile wanatarajia kulipwa, na kila factory italipwa kulingana na price ile wanauza majani chai yao.
Kilifi Woman Representative Gertrude Mbeyu has called on Kenyans to give the new university education funding model a chance, expressing confidence that it could significantly benefit students, particularly those from vulnerable families. Speaking to the media in Kilifi while distributing water tanks to schools in the area, Mbeyu emphasized that the previous funding system did not produce substantial results despite the considerable financial investment.
Chairman, Secretary, hawana wajaribuni, walikuwa wameomba tank, wale jaribu na madrasa waweze kusaidika. Kule ni upande wa Kauma sub-county. Kama itaweza mfumo huu unaletwa, utaweza kusaidia watoto wetu, wanafunzi wetu. Sisi tunakubali, mimi nitakubali, mimi ni mwalimu. Na ile tathmini ambayo nimefanya, mbali na ule mradi wangu wa food scholarship ndani ya Kilifi, ndani ya ofisi yangu ya Ngafu, sijaona ile impact ya zile pesa sisi tumetumia. Hatuna ratiba ni watoto gani tumewalipia fee, wamefika wapi. Kama mfumo utaleta tofauti, kama vile rais alikuwa anatetea jana KICC kuhusu huu mfumo wa funding, the university funding, wacha tuone haya mabadiliko kama yataleta mabadiliko katika maisha ya watoto wetu. County government si role yao kulipa fees. It's not in the constitution. Education involved kwa county government ni ya ECD peke yake. Wajenge madarasa, wanunue furniture ya ECD, wanunue uji ya watoto, hata wakanunua uniform. That's their role. Education is devolved to the county government. County government zile zinalipa basari ni kuongeza gharama kwa watozwa ushuru wa county government people, na si role yao. Kikatiba hakuna pahali mambo ya county government ilipe basaris.
With that story from Kilifi County, that's where we wrap up K24's newscast. Thank you so much for catching time. My name is Joel Chacha. The sign language interpreter is Walter Sewe. Good afternoon.